Dr. Sally here. Today I have the pleasure of speaking to a really wonderful friend, Penny Feiner. Penny Feiner has an incredible story to tell us and some wisdom to share with us. And although her story is not about Lyme disease, it's about another type of struggle. And welcome, Penny.
Thank you, Sally. So nice to talk with you.
So, can you share with our audience today what your struggle was 33 years ago?
I sure can. This coming December, I will be celebrating 33 years clean and sober. I had a cocaine addiction that kind of developed, I would say, somewhat gradually. I was a dibbler and dabbler drug user in my college days, and that amounted to occasional marijuana and sometimes quaaludes and every once in a while a little bit of snorting cocaine. And then I left school, went to grad school, got married in school, got divorced, and in my early 30s, very early 30s, started to get involved doing freebasing cocaine, which later on was called crack, and found myself literally wrapped around a crack pipe. I was working full time for a family business. I was kind of a high functioning crack addict, if there is such a thing. At least I thought I was high functioning. I'm not so sure I actually was functioning at all. But my experience was that the things that used to matter to me and were important to me lost their meaning, and all I could think about was how am I going to get high and when am I going to be able to get high again?
Right. So you really had a big challenge in your life.
Yes.
And what turned that around?
I had an experience while freebasing in the dark kitchen that I lived in, where I think I experienced my first atrial fibrillation event. I was smoking
Can you
crack and
say what atrial fibrillation event is
yeah,
for?
it's when the electrical system in the heart goes haywire. Instead of a heartbeat going lub dub lub dub lub dub at a variety of different rates, I felt like there was a jazz band playing inside my chest, and it was lub blah, da, 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 ba, da, 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 ba, da, 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 and I knew something was dramatically wrong. And in my drug-induced craze, I just kept hoping that my heart would go back into sinus rhythm, which is the regular rhythm, the normal rhythm, and stop freebasing long enough for that to happen. And as soon as that happened, I started to put some more cocaine in the pipe. And I recognized that that was a very crazy, sick thing to do, and that the degree to which I was hooked on the desire, need to be high was probably going to kill me. And so I stopped. I threw out my pipe, I threw out my drugs, and that was not the first time that I had thrown out my pipe and my drugs, but somehow, by the grace of God, that time it stuck. And I kind of white knuckled it for 3 weeks or so. That was December 7th. And then my brother, who I used to call my partner in crime and also was involved with drugs, was very, very desperate and needed to be an inpatient. And he called me and begged me to take him to a hospital before he committed suicide. So I did and left him as an inpatient at a hospital in Manhattan. And when I got home, the hospital called and said that your brother told us that you are also using and abusing drugs, and you will not be able to come and visit him unless you can produce clean urines and show that you are drug free. And so in some ways, I had stopped 3 weeks prior to his becoming admitted to the hospital, and it was a gift to me that he ratted me out pretty much, because my motivation, this was my baby brother, I love him dearly, and my motivation to stay clean, no matter what it took, came from love and the desire to be there for him. For the first month or so of my journey into recovery, I really had the sense that I was doing this for him, not for me. And then I realized somewhere along the way that I was doing this for me.
Powerful story, Penny. Powerful story. So the analogy that I want to take for our audience is that sometimes we have a health issue. It can be something that you create for yourself, so to speak, with a drug addiction, or I'm not sure if that's accurately put, but in any case, or you have a health issue like Lyme disease or any other chronic illness, cancer, and you get in a hole and you have to find a way out.
Yeah.
And so we're not talking about someone today or talking with someone today who's climbed out of the Lyme hole, but we're talking with someone who climbed out another hole. And I think it's really super helpful to hear the kinds of things and the way that she thought about it. So continue with your story, Penny.
So I joined an outpatient therapy group in Manhattan. I was living in Englewood, New Jersey at the time, and was traveling, I would say without traffic, somewhere in the neighborhood of 25 minutes to get to Regent Hospital where the outpatient group was held. And I found myself really, through the power of connection and other people struggling with similar issues, supported and feeling little by little like I could do this. Honestly, when I first put down the drugs, and by the way, the hospital's philosophy was that if you are abusing one substance, you have the addiction as part of your disease, and you will likely abuse another substance. So it wasn't about putting down cocaine and then it was okay and I had permission to do marijuana or alcohol or anything else. It was all about abstinence. And I really, at the beginning, had a hard time imagining a life without those crutches. And what I began to understand through the group therapy setting and my own path of self-discovery, that the drugs and the use of the drugs were kind of a way to avoid, mask, numb feelings of inadequacy, feelings of failure, feelings of lack of self-worth. And, I recognized that my self-esteem had been contingent upon achieving certain goals, like being a great student and making my parents proud and yada, 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 but not really connected to who I was as a person. And so I really began this journey of self-exploration, and in the process of getting on that road to recovery, found the rooms, found AA, and I ended up landing in AA versus Narcotics Anonymous because I found that in NA there were not very many people with long-term sobriety, and I really needed to hear that people can do this as a lifestyle. I wanted to hear about people who stayed clean for 10 years and 15 years and 20 years. And in NA meetings at that time, I was hearing like, hi, my name is Penny and I have 2 months clean. Very short-term sobriety. And so through the group, there were 12 people in my outpatient therapy group. We met twice a week for several years. In that course of time, several of the group members were dropped out of the group and several of them died from drug and alcohol overdoses. It became really clear to me that I wanted sobriety, that I wanted to crawl out of that hole that you described. And I made it my priority. And that meant changing some friendships around and changing places that I hung out and really being vigilant. At least in the first few years of my sobriety, it required vigilance, and I never would go to a party unless I had my own car or a way to leave when I needed to. I didn't go to many parties, period, but when I did, I needed to be sure that as soon as I started to feel squirrely, I could get out of there. And then I found yoga. And yoga and breath work and meditation and chanting have been my long-term continual lifeline into a life of wellness and health and making self-care primary care.
Right. And the breathing and the chanting and the connection to nature is the same system, the same concepts that I teach for Lyme recovery. So that's why this is such a powerful conversation today. So, how did the breathing and the quieting of your mind help you to move forward?
In the quieting of my mind, some of what I'll call my demons started to soften and vanish. So that self-critic, that little voice inside that was for a very long time haunting me on some levels, kind of started to, and in that quieting of the voice, there was this beautiful space to be held in something other than criticism, self-criticism, to be held in self-acceptance, to be held with compassion, to be held with kind of tenderness and caring that I needed to experience in order to crawl my way out of that hole. I felt a tremendous amount of shame initially when I started to, uncover the degree to which I was an addict.
Right. So when you breathe, how do you conceptualize your connecting to the universe and to a higher power and to this guidance? Do you?
I do. I think that the breath was my first and continues to be a connection to the universe and to the forces and powers that be outside of me. And initially it was the breath that allowed me to begin to quiet my mind a little bit. I could quiet my mind, but my body was racing. So I was one of those people that when I did my first yoga teacher training, one of the requirements was to do a meditation practice for 40 days straight. And I could not sit still to do a meditation practice. So my teacher suggested that I do a moving meditation, and I ended up walking around my dining room table in sort of rectangular circles, because it was a rectangular table, over and over and over again for 20 minutes a day, saying to myself a mantra. And I think by day like 30 something, at the end of my moving meditation, I would sit in one of the dining room chairs with my feet on the floor and my eyes closed and my hands resting gently in my lap, and I could sit still for a little bit of time. Little bit. I mean, I'm talking maybe a couple of minutes, 2 or 3 at the most.
But a couple of minutes is a great starting place.
It was a beautiful starting place. And from there, I got involved in the actual vinyasa, the physical practice of yoga. And for me, that the moving through poses from one pose to another and the transitions in between and coordinating the breath with movement was kind of another form of moving meditation. And then fast forward to, I would say it's probably about 4 or 5 years ago now, that I was talking to a dear friend who really wanted to begin to establish a regular, steady, seated meditation practice, and I felt the same way. And we said, okay, let's do it, and we'll hold each other accountable. So every morning for 40 days, we would check in with each other and say, done, or I'm starting now, or whatever. And at the end of 40 days, my friend Ben said, so now what? And I said, another 40. And so that was 5 years ago, and we're both so blessed and grateful to have an ongoing, really committed meditation practice now. One day you're going to be able to sit still and meditate. I would have said, you're crazy. It won't happen. And it happened.
And you look forward to it.
I do. It is in that stillness. For me, it is in that stillness and in that quiet space when if I'm sitting for 21 minutes, maybe there's, I don't know, maybe there's 7 or 15. Some days maybe there's only 18 minutes of, there's 18 minutes of chatter and 3 minutes of, kind of deep silence. It's in the silence that I feel connected to spirit and that my personal creativity is nurtured.
Actually, I just want to say that you had a moving meditation, which is totally acceptable. I mean, there are cultures that have moving meditation. So I always suggest to start with what I call special quiet time, which is taking a break from whatever you're doing, going outside and looking at nature, studying. You're seeing, today there were these spikes coming out of the palm trees, or, today I see that the birds are flying in unison, or whatever it is to connect to nature, breathe while you're doing it, appreciate what's going on. And I think like a walking meditation, that is a good stepping stone to a regular seated and still practice of meditation. So I encourage people to get started that way. But Penny, so from what I hear, your meditation practice, you're connecting to the universe, not only reestablished, resuscitated your health, but it revitalized your creativity.
Absolutely. And as a young person, a little person, a munchkin even, I was always singing. And I imagined and fantasized at some point in my life that I could be, the next Joni Mitchell or Laura Nyro or, somebody like that, Stevie Nicks, somebody like that. And I was terrified of singing without being high because I didn't know that I could. And, a couple of years ago, I produced and wrote a number of chants, and a friend of mine who's a music producer put it all together for me. And I now have a chanting CD, and next winter, this coming winter, I'm going to be working on another one. And, I've been writing music and singing and playing and just really blossomed in that area of my life in a way that I feel so blessed. It's really my every morning my meditation practice begins with a chanting practice.
Where can people find your CD?
It's on iTunes or what's that, CD Baby, all of those digital opportunities. It's there.
They would look under Penny Feiner, Pennifeiner.
That's right.
Okay, great. So yoga and breathing, they have medical health benefits. I think on your website, Kula for Karma, that's another place you'll find Penny, Kula for FOR, Karma, Karma. But you talk about improved sleep, increased immunity, decreased pain, improvement of the endocrine function, blood pressure regulation, improved balance, increased flow of oxytocin, self-acceptance, reduced anxiety and depression. So we can really see how all those things, whether you're coming from a place of a health issue of an addiction or you're coming from a health challenge from a mitochondrial deficiency disease, that breathing definitely helps you, right?
Absolutely. I think it's the key to everything.
It's the,
Through Kula for Karma, we have many hospital-based programs, and I have the pleasure and the gift of being able to sub for some of our regular teachers every now and again at the John Thurr Cancer Center, part of Hackensack University Medical Center here in New Jersey. And when I go to the classes that we have for the cancer patients, and these are all varieties of cancers and people in different levels of treatment. Some are in active treatment, some have completed their chemo and or radiation treatments for a while. Our goal, Kula's goal, is for everybody in that room to feel successful. And sometimes all that we can do, and I don't mean all in a belittling way, but all that we can do is teach about breathing.
yeah.
We're sitting in a chair, we're teaching about breathing. We're not talking about turning your body into a pretzel and standing on your head and, balancing on one finger. We're talking about connecting the breath, mindful movement and observation, and that's it.
That's great. So I think you've written that you turned obstacles into opportunities, challenges into change, stumbling blocks into stepping stones, losses into gains. That's
Yes.
just so beautiful.
And by the way, that's the chorus to this chant that I wrote, and I will be recording in the winter. And it's actually something that I sing to myself every day as a reminder, because I think we all need to remember what the tools are and where they're stored, and to take them out of our pockets or our toolboxes and use them.
Right. When you were going through this, where was your goal? Was your goal the next day or was it a healthy, creative Penny Finer?
The next day. I couldn't even imagine back then, 33 years ago, what this looks like now. No way. No, I know how. It was just like, can I get through this day? Sometimes, can I get through this hour? And it was literally one day at a time. They say that in the rooms, and that's what it is, one day at a time. And sometimes when things get really challenging, Sally, dealing with aging parents who are sometimes in better health than others, and right now, knock on wood, everybody's good, or a friend or a partner or whoever, we're all dealing with challenges. When things get tough and I feel like, I have way too much on my plate and I'm totally stressed out, I go to the practice. If I need to meditate again for another 21 minutes, or take out my guitar or the harmonium and sit and sing and cry and sing and let the tears come and let the feelings be, I know how to manage these things as they come up.
Right. Well, that's so important. We all face challenges, so that's an important message. Can you comment on how people who have disabilities from chronic illness can practice breathing and practice yoga? Because I always think of yoga as these insanely
Yeah.
wonderful poses.
Yeah, there is a therapeutic yoga movement happening now where people are being trained not just to be yoga teachers but to be yoga therapists, and that means that they are able, ready, and willing to work with a variety of populations who could embrace a chair yoga practice, for example, or could embrace a restorative yoga practice, could embrace something very gentle and very modest movement that's doable for a particular population. Kula for Karma's programs are primarily located in the Northeast. We are going to be expanding into Florida and Colorado and the state of Washington and Maryland. And hopefully at some point, the answer to that question would be, type in www.kulaforkarma.org and you can find a program in your neighborhood at some point, 10 years from now, perhaps. But for now, I think the challenge that so many of us face when we approach the idea of yoga is we get stuck in thinking we have to do this or that or the other thing with our bodies, and we're not okay with where we are in the moment. And that's a very big, important message that as a yoga teacher, I try very, very hard to communicate to the people that I'm teaching. It's not a competition. It's not about, what the other person is doing on the mat beside you or in front of you or behind you. It's what are you doing in this moment and what feels good to you in your body.
Absolutely, absolutely. So can you extrapolate from your experience of having a health problem that really placed you in a deep dark hole like so many chronic illnesses do? You get thrown into a deep dark hole. It's overwhelming, so many different options. What takeaway piece of advice would you give everybody?
I would say one day at a time, to try to keep things, set manageable goals for ourselves, things that really are doable, that we can accomplish, and then be able to, kind of chart progress. Think about progress, not perfection. Think about baby steps. One of my yoga teachers said, often, suddenly is a whole lot of gradual.
That's great. That's really good advice. I'm reminded that Eckhart Tolle says, teaches to be in the now, and breathing is to be in the now. How are you able to be in the now and yet know you're making progress?
Well, for one, with drugs and alcohol, it's pretty easy. If I'm not picking up, I'm making progress. I think the being in the now it's a gift in that we can experience and enjoy the moment. And then also have the experience of observing when we're not in the moment. For many of us, myself included, I can get to a place quickly, very quickly, where I'm not present and my mind is somewhere else. My body is present, but my mind is somewhere else. And I try very hard to be mindful and observe when that happens and use then the breath as an anchor to bring me back. I mean, the breath, thank God, the breath is with us all the time. If you're breathing, you're alive. and you have it, and you don't have to worry about forgetting it, like your purse or your wallet or your keys. And so to use its very presence and accessibility as a tool for coming back to present is the best advice I could give to anyone.
That's great advice, Penny. Thank you so much. Everyone wanting to know more about Kula for Karma, Kula for Karma, FORKARMA.org. And Penny, I think you've been an inspiration to so many people because to me it's a challenge recovering from chronic illness. It's a challenge recovering from addiction. And there's so many lessons that cross over. And I thank you for sharing.
Thank you. Thank you, Sally.